Gentlemen, first of all, I would like to thank for the invitation to this very interesting meeting here. And we continue with animal nutrition now, and I will try to give a little bit more review about this. We heard some details now about fish. Fish is a little bit a special program. I will come back to this one. I will follow this table of content here after an introduction, maybe also some repetitions. I will try to define a little bit what are the problems from the nutritional view. I will show some animal experiments and the conditions, the prerequisites for such experiments, and then also come to some new developments from my view. To the introduction, I think we have three general global developments or global challenges. First of all, population is increasing and the need for food is increased. The resources, maybe arable land or water or phosphorus or whatever, are lower, are reduced per people, and of course the emissions is an increase of emissions all over the world. These are our conditions at the moment, and that means we need more feed and food. Here is a kind of a review, one of the last FAO values. You see the average intake all over the world, milk, meat, eggs for animal products, not fish is not mentioned. And this is a general value for edible protein of animal origin, around 20 grams. But if you consider the range between the lowest and the highest values, it's unbelievable. And this is also a real challenge for all of us to do something, and also the increase of the population to 9 billion people from about 7 to 9 billion people, and the increase in income. These are also the powers to ask for more feed and to ask for more food. The consequence, or one of the consequences of the FAO is to assess that we have to expect nearly a double in the production of meat and milk up to 2050, and that means we need nearly double on feed for all the animals. And that means, for my understanding, the plant breeding, traditional plant breeding and maybe also the biotechnology, is the starting point for the whole food chain, and therefore we have to struggle and we have to learn many things in this field. If I consider the points for this food chain, I would distinguish in unlimited resources, here shown in green, and in limited resources, agricultural area, water, especially arable land, fossil fuel and mineral nutrients, for example, decrease. And we have sun energy, we have plant nutrients in the air, in the atmosphere, nitrogen, carbon dioxide increased from 380 to more than 500 ppm, and we have also the variation in genetic pool. And therefore, we are challenged as traditional breeders and also maybe with modern methods to reduce, to make the plants more efficient, to produce low input varieties with all these ingredients for production, and to use these levels very efficient. There is additional point belongs on the so-called expected climate change. And you see the colleagues expect a larger technological gap between the conventional breeding and the effects, the necessity based on the climate change. And this technological gap should be keep in mind for the future developments. Let me summarize from the nutritional point of view the wishes to the plant breeders from the global view. We need higher and more stable yields because of the competition for land, for consequence of climate change and so on. We need more resistant plants against biotic and abiotic stressors. We need a more efficient conversion of the limited resources, mentioned already, and a more efficient use of the unlimited resources. And of course, another objective of the plant breeding could be, but I have a very critical attitude to this one, maybe also to change in the composition. That means more valuable ingredients and less anti-nutritive substances. This could be our wishes to the plant breeders from the view of the animal nutrition. Now we have seen already this figure from the first speakers, and also the plants in commercial commercial use. This is a group from the JLC, Stein and Replace from 2009. Nearly all of the GM plants shown here are in the insect-resistant or herbicide-tolerant plants. Let me come now to the animal nutrition. I think, also my feeling in the EFSA panel, we discuss about human nutrition, but if we consider, this is our own estimation with some colleagues from the feed industry, around more than 3/4 of the products are going in the animal feeding, are going as feeds, soybean, extracted oil meal, other full-fat soybeans, in the case of maize, in the case of canola, rapeseed, and also cottonseed. And only 15 to 25%, maybe only the oil, some proteins, you see some fractions here, or some starch, are going to the human nutrition. Therefore, the animal nutrition is the most fraction, the most scientific section dealing with such products, because 70 or more % are going to animals. What are the questions to the nutritionist? And first of all, I would like to define something a little bit. I would, from the view of the nutrition, I would distinguish in GM crops, GM plants, of the first and of the second generation. The first generation is, for our understanding, no substantial changes in the composition. This is the principle of the so-called principle of the substantial equivalence is valid in this case. Examples are mentioned here. And this point, the so-called second generation, this is very interesting for the animal nutritionist. What about the bioavailability? What about the digestibility? These are plants with so-called output traits. Also maybe the golden rice is an excellent example for such group of plants, with substantial changes in the composition or also in the nutritive value, and they are not substantial equivalent to the isogenic, so-called isogenic counterpart examples are also mentioned here. This is the first definition from our understanding. The term substantial equivalence. We have also some problems with this term. This is very old, 20 years old now. And it was a compromise, maybe I think a compromise to find a comparison between GM and non-GM plants. But the problems are mentioned here. Of course, it's a very coarse framework for first evaluations. Kind of limited safety and nutritional assessment is given by this substantial equivalence. But what means traditional counterpart? We discussed it already in the meetings this morning. And also, in the case of the second generation, of plants of the second generation, this is really irrational, this substantial equivalence. And we would like to propose more to distinguish, maybe in the chemical equivalence, in the nutritional equivalence, safety equivalence, but I will come back to this definitions. What are now the questions to the animal nutritionist? The first question to ask, what about the nutritional and the safety assessment of feed of the first generation? Do we need so many experiments? We discussed it already yesterday. What about the studies with the second generation? I think there's an urgent need for more studies. And of course, what about the influence of the GM feed on animal health and the quality of food of animal origin? What about the fatty acids or the amino acids or the quality of the products? And of course, what happens with the newly expressed proteins, we mentioned already, with the DNA and so-called unidentified effects. These are the questions asked to the animal nutritionist. There are some studies, some guidelines, from the EFSA on the one side, from the EFSA on the other side, and also from other national organizations from Australia, from India, from Brazil. And let me mention two new EFSA activities. At the end of 2011, we finished a guidance document for GM animals, maybe very interesting for some people. And also, this is not the best solution, a 90-day toxicity study for the whole food feed. This is not the best solution, I think, personally. Let me come to some experiments with food-producing animals, especially with pigs, ruminants, and poultry. First of all, such an analysis, such a study has to start with a compositional analysis. You see, if we consider a dossier from a company, from an applicant, normally between 60 and up to 120 analytes are determined in a feed. This is an excellent level of feed science, what we see now. If I come a little bit from the feed science, from the traditional way, it is an excellent discipline. You see some examples for non-ruminants, and for pigs and poultry, for maize and for wheat, or here for oilseeds. And I think this is the first important point, to look what about the composition, and it was already mentioned in this discussion. If I consider 2 or 5 isogenic plants, I have also a certain variation between. This is quite normal, and this is also typical for animal nutritionists. No plant is the same plant. In the case of BD products, which express BD protein, we found, also many colleagues, this is a reference, list of references, found significant differences between some mycotoxins in the products. The fumamicins, the reduction to 20% depends on the effect of the protein to the European corn borer, and the higher stability is more powerful corn plants against insects. That's only one result. Let me summarize now a little bit what are the questions for animal feeding trials. And I will ask a little bit in a critical point. Do we need additional information to the compositional analysis? I mentioned the broad field of analysis. Do we need silico, vitro, and situ studies? What are unintended effects, and what do we expect under such effects? All people ask for unintended effects, but nobody is able to define it. What does it mean? Do we expect long-term effects, including animal health, fertility? I think we have to decide step by step, or case by case. This is a very difficult question because it's extremely expensive in time and money, such studies. Do we expect effects on the productivity? Could be of importance if we expect fatty acids a pattern in the product. Do we need additional information for GMP or from GMP with output rates concerning the bioavailability of the nutrients? Or what do we expect from GM animals? Do we need new energy and nutrient requirements of such animals? Could be. If they have a higher protein gain, we need a higher amino acid supplementation. Can we expect innovations for safety and nutritional resource? This is a challenge for the feed science in the future, I think so. And are animal studies important, or are they necessary from the view of public concern, or may the studies probably contribute to more public acceptance? Also a question for me is this. We discussed it already, especially for the European conditions. Do we need such studies on the consideration of this situation? For my case, or for my understanding, we should decide case by case and not follow general rules. I would distinguish in the following types of feeding studies with target animals. We need, of course, especially with plants of the second generation, such metabolism studies, digestibility, bioavailability is very, very important. EFSA 2008 is a good guideline for this. Tolerance studies, efficacy studies. We need, in some cases, long-term studies. Also, a result from the group here, this study this review by Chelsea is a very good overview about the present studies done in this field. Multi-generation studies, also in this study. And of course, with animals, we have to start what have we to do in the future. Some studies, especially here in the first case, of course, these are studies with laboratory animals, but also long-term feeding studies, multi-generation studies, and the determination of the digestibility, the bioavailability of nutrients, we can also use laboratory animals. But in the most important cases, we should use target animals, because I told you 70–80% of the feed is go into the animals, and therefore we should make studies with target animals. This is an important recommendation by Ilse, also to the last speaker. In most studies, a test transgene and the near isogenic counterpart as control compared, but preferable 4 or more conventional varieties may help to explain unexpected differences. We have to ask the question, what is normal? And if I remember the studies by Hemrus, the Salmon studies from 2007, I made a note behind this. what is normal? They were not able, the authors, what is the normal, the lower or the higher values are the normal, because if I don't have such a comparison, and I don't have reference varieties in a certain amount, I think it's very complicated to give a scientific answer. So, that means the experimental designs in such cases should follow allogenic, transgenic, and some conventional counterparts, at least 3 or 4, in order to see what is normal, to see the biological range in this specific case. An example for this video. This is a oil study with these mice, a high portion of factor oils, and you see three non-transgenic conventional hybrids of autofat. No difference in the final weight, in the feed conversion rate, in the body, in the weights of some organs, but the weight in gram per kilo body weight of liver in the case of females was 3 grams lower in the case of the control. And there was a very discussion also in the public, the other study in 2007, 2008, the GM laying hens, the female broilers, the female chickens, the female broiler have heavier livers, very, very problematic, very difficult. And also, I have such a list of studies with some discrepancies or differences. And if you consider the confidence interval in consequence of all the 5 groups that you see, the 95% confidence interval is in this region, 20 to 50 grams. And I think this may be statistically significant, but biologically irrelevant. And therefore, there is a new EFSA document, maybe interesting for some of you, December 2011, and the colleagues asked the question, statistical significance or biological relevance, and they come to the conclusion that we have such an interval estimation, we should do such an interval estimation and should work with a confidence interval. I think it's a little bit the answer to the questions discussed before. As you see, the EFSA makes also very sensible things, yes? What are the endpoints for animal feeding studies? I think, for my understanding, the simple parameters, feed intake, weight gain, body weight gain, or the yields in X, in feed conversion rate, or the milk performance. The animal behavior is very important, health, mortality, fertility, physiological parameters. We should include physiological parameters, maybe enzyme or hormone activities in some cases. The weight of organs, of tissues, or maybe also the length of some release. And of course, the chemical composition of the food of animal origin, that means eggs or tissue or the fish as before. Now let me come to some results from studies done with GM plants with input traits, also with the first generation. This is, I should a little bit update this one. This is from 2010. About 140 studies were available, and you see the nutritional assessment on the right side. No unintended effects in the composition or contamination with other things. No biologically relevant effects on the digestibility in animal health. Plants of the first generation are analyzed here. And no unintended effects on the performance of animals and the composition of food and energy. As I already mentioned, the fish are a little bit out from this conclusion. We studied all the handling studies from 2007, 2008, they are in this summary, and it's a little bit difficult to come to the clear scientific conclusion. Let me show some individual studies. This is a German study with dairy cows. I think it's one of the biggest studies which available. 2 groups, unfortunately only 2 groups, isogenic and transgenic, because it's too expensive, for 25 years, 2 lactations, a very, very long study. And you see it's done in Munich, 63% of the ravage came from 1-8-10 and 41% from the concentrate. It's a very high portion of GM products in the feed. You see no, it's the first lactation, the second lactation, no significant influence on the milk yield or on the other parameters, and also no fragments of the DNA and of the no expressed protein were detected in the animal products in blood, milk, feces, and so on. This is one of the largest study, and maybe one long-term or one multi-generation studies, one of our studies. For 10 generations, we fed to quails between 60 and 50%, 60% in the growing period and 50% in the laying period of BT maize. And you see that each generation, first to 10, these are the averages of the generations. This is the body weight of the young quails. These are the laying intensity, isogenic, transgenic, and this is the hatchability, as maybe the reproduction of the quails, and 77% is hatchability for quails is very good for our knowledge. Quails are very sensitive in this case. So, then we come to the more important and the more difficult problems of the nutritional safety assessment of GMP of the second generation with output rates. We can have very some output rates increasing variable substances, nutrient precursor. Let me start with the beta-carotene or some nutrients or substances which improve the digestibility, maybe some enzymes or some other things, substance with a surplus effect, prebiotics, or with improved sensoric properties, or the plants have a lower content on anti-nutritive and antisocial substances, maybe lignin, phytate, glucosinolates, or some other products. This is known, these are some examples for this. And let me comment a little bit from the view of animal nutrition. From the view, the pros and cons of such substantial changes in the composition. The pros on the human side, I think this is clear. These are advantages for the human because we are better able to meet the requirements in amino acids, in fatty acids, in minerals, and vitamins, especially beta-carotene or vitamin A, and ultimately improvement of properties of food. But from the animal nutrition, so my personal, I'm convinced about this. We don't need such activities because in the European Union we have 2,000 feed additives produced by genetically modified microorganisms. Feed additives for enzymes, for all amino acids, all vitamins. Therefore, and they are available in the market, they are cheaper, and this is much faster. The plant really need a longer time to produce it in such a way compared with other chemical ways. And therefore, there is a discrepancy between the need in such changes from the view of animal and human nutrition. For the experiment designs, for example, this beta-carotene, we need some other specific designs. Maybe I will show it in a practical example. This is an older study. The colleagues tested carotene maize rich in carotene, and they used 4 groups: the unsupplemented control group, then they supplemented, they used the carotene-rich maize, and they supplemented beta-carotene and vitamin A to the unsupplemented control. They expected amount of beta-carotene to the same level, 8.8 nanomole for the plant and for the adult, and the half of vitamin A. The theoretical retinol intake should be 106 nanomole per day. And then they looked for the Mongolian gerbils, I think so, yeah, Mongolian gerbils for the animals, and they didn't find any effect on the blood because the blood is a very bad indicator for vitamin E in the animals. But they looked for retinol in the liver, and you see the unsupplemented control. The animals were depleted before the study, and you see it's the same values for carotene-rich maize and the supplemented beta-carotene, and that means the carotene from the maize has the same bioavailability as the beta-carotene from the chemical bag. And with vitamin E, you see it's much higher, more than double high. But in such a way, we have to follow, and it's also a little bit the weakness of the beta-carotene in the golden rice at the moment. I don't know such studies. We need such studies for nutritional assessment of the bioavailability of such substances. Another example for plants with the second generation, it is maize with a lower phytate content. Phytate reduced phosphorus availability. Here's a very nice study to this. Control maize with a very low content of available phosphorus, only 0.3 grams, and the phytate, low phytate mice with 1.76 times higher, and they supplemented mineralic phosphor plus, minus plus, 2 grams, you see it's mentioned here per kilogram feed. Only some figures, the supplemented, mineralic supplemented control maize resulted in the same daily weight gains as the without any phosphorus supplementation, but the low phytate maize. And let me consider the phosphorus excreted by the animals, about 9 grams per kilo body weight, and here only 4 grams. This is also an environmental problem, or environmental advantage to have such a solution. So, fatty acids is a very hot topic at the moment in many, especially in many oils and soybean oils, but also in canola. A very interesting way to find, to produce fatty acid, omega acid with 4 double bonds, the so-called stereotonic acid. And you see the delta 15 and the delta 6 desaturase were introduced in this soybean. And so we find certain concentration of more double bonds. This oil contains about 25% of these fatty acids, unusual up to now in the nature. And you see the other fatty acids are, especially 18-2, linoleic acid is reduced. Unfortunately, some traces of trans fatty acids were registered or were found in this oil. We have also some feeding studies with this oil already. Let me show some figures. Control oil, and here in the starter 45 and the finish of 50 grams such SDR oil. And you see in the breast meat, in the leg meat, and in the skin dramatically increased in all of the stereotonic acid, but also of the C25 and 22,6, also the essential amino acids for humans and also for animals. That means this oil is able to replace fish oil and could be also helped in fish to find higher amounts of the typical fish fatty acids. I think we heard already some things about this. This is only a summary about the degradation of the trans DNA and the degradation of the newly expressed protein. In summary, from all our studies which we did and which we looked in the literature, there is no advice that newly expressed proteins or newly expressed DNA are characterized by other chemical or physical properties as native proteins. This is still, I think, is still true. Some remarks to future tendencies, to some trends. We heard already the first speaker spoke about this one. We have to expect a combination of many stacks, up to 6, 8 or more stacks in one hybrid. You see in this next slide already 2008, about 20% of the cultivated GMO came from stacked traits. This is very, very important this way. There's another point, the improvement of nutritional properties, as already mentioned. We have to look for more efficient use of limited resources, as low input varieties. And of course, the GM animals are also a real challenge for nutritionists to look what happens in the future. We saw this figure already from Stein 2050, I don't want to repeat it. And maybe new. Climate change is a very hot topic in the discussion in scientists. And there's a new paper, a new book about this field, and they expect some more advantage or some more progress should be spent with this one. Maybe we have to expect greater extremes in climate conditions, higher temperature, the water supply already mentioned, the increasing in soil salination is very, very important, the salt tolerance of the plants. And of course, the more efficient use of nitrogen and of carbon dioxide, and also the higher disease infection could be expected. This should be also considered by plant breeders in the future. And let me show some slide from the transgenic animals. This is 10 years old now, a Canadian work with the transgenic pigs. Such studies are also done with poultry, also salmons in some cases. And you see the saliva expressed at 5 days an enzyme, from E. coli, and you see the phosphorus digestibility of the non-transgenic animals increased from 48% to 88%. That's unbelievable, and in the case of the finishing period, nearly to 100%. This is unbelievable. But these are very interesting developments, and in this case, we can expect very interesting things. Let me conclude something. From the view of animal nutrition, I think we should be included in such studies as soon as possible. On the one side with the plant breeders, in order to see what are the consequences of your measurements, what about the bioavailability of the ingredients of the protein, of the amino acids, or maybe the conversion of beta-carotene and vitamin A. And also in the case of animal nutrition, can we expect other requirements? Do they need more nutrients or other feeding? This is one point, one conclusion from my point of view. There are still some open questions. Do we need more stack events with more feeding for trials with stack events? Because there's such a discussion. There is an increase in transgenic DNA and also more expressed transgenic protein in higher amounts. If we have stacks with 6, 8 or 10 stacks, this is a 10 or 15 or 20 increase of some proteins. Do we need more feeding trials with GM plants which use resources more efficiently? Maybe the principle of substantial equivalence may be valid for this group, but do we need animal studies? This is also the question is very delicate. Do we need adequate studies with plants and with feed from traditional breeding? If I ask for feeding studies with plants of the first generation, why not with such things? This is the same situation. We have also a dramatical influence on the composition, on maybe the DNA fragments. And which types of studies are necessary with GM animals? If I try to summarize the present situation may be more tolerant plants against herbicides, against insects, ingredients and less unpenetrative substances, and more efficient use of resources. And I distinguish in the present significance, the highest significance for the first two. If I consider the aspects, the contributions to the food safety, you see a little bit more or less, maybe high or not really important. But if I consider the global food security, or maybe also the sustainability of agriculture, I expect the highest effect here in this direction. The other ways, therefore I have also a little bit problems, we discussed it already, with public sponsored research and with research by the private industry. And no, I accept that the private industry is also going this way now, but nevertheless we have to make some progress in this way to overcome many, many problems all over the world. Let me summarize it a little bit. We learned already more than 1 billion hectares have been cultivated now with GM 1.25. Most animal studies were done with GM crops of the first generation, with so-called input traits. No unintended effects in composition except lower mycotoxin content. In nutrition and safety were registered in about 150 studies with food-producing animals, with target animals. Fishes, salmons are a little bit, have to look a little bit more intensively. Transgenic DNA newly expressed protein shows similar properties during the processing and in the animals as normal plant DNA proteins. Other experimental designs are recommended for nutritional and safety assessment of foods of the second generation with output rates and of course with GM animals. Furthermore, case-by-case studies seem to be necessary to answer open questions. More groups with isogenic counterparts should be included. I think we will get better answers. And feeding studies with food-producing animals should be also used for safety assessments. Also a problem for myself. We make rat studies and other studies with rodents, but here we have a very, very large experiments, large number of animals, and we should also use not only the weight of the wings and of the legs and others, we should also physiological parameter using and maybe also some other physiological parameters from the animals in order to use it for the safety assessment of GM food and feed. Thank you very much. Das wollte ich noch zeigen. Das sind der Nachwuchs von übermorgen, die den GM-Produkten aufgeschlossen gegenüberstehen. Das sind zwei Grandchildren von us and she tested.
Thank you very much for a very comprehensive overview. You need the fish data in there as well, more carefully maybe. But I think this was a very good background for us in this meeting. Any questions, comments? No? I'm surprised that you couldn't find any significant differences in any of these 150 experiments.
The fish, yes.
Yeah. There has been done 150 experiments with other animals than fish. And there is not a single significant difference. I'm really surprised.
This is my review for literature with some disturbances.
Disturbances?
You see,
That's what they call it.
I implemented it too. The comments, what is normal? This is a problem if I don't have.
Yeah, but that's the fish study. I'm not talking about all the other studies.
No,
I'm surprised that there are no significant differences.
Summarized. McNaughton, I mentioned also McNaughton, for example, difference in the liver.
Okay.
And those, maybe Maladestar, you know maybe the Maladestar study is very broad, and here's a Carolini, of course. But most of them are not published in scientific reviewed journals.
Exactly. Most are not published in scientifically reviewed journals. And that's the problem. I think we need more data.
We are in Vienna now, the Australian study here is a nice study, yes?
Yeah. No, I'm just saying it's pretty loud in here. Is some questions? Yeah, there's a bunch.
Okay, yeah, so perhaps the hesitance in raising the question was a little bit about the overwhelming amount of information you got over the slides. Thank you very much. So being a little bit provocative, you have made some points with regard to the limitations of nutritional studies and feeding studies, and in particular, for example, feeding studies with whole food, like rat feeding study with whole food or something like this. This has limitations, as you said, and might be not the very best solution for assessing something. Completely with you. So also sees the limitations here, but being a little bit provocative, what is about the idea to simply say, yeah, testing the protein, if there is new protein inside a plant, and in addition, whatever, having a baseline and a reference with conventional breeding, and referring to conventional breeding and comparing to conventional breeding what is analyzed in that regard, knowing that that has a history of safe use in the past. So there will be a provocative approach, yes, would reduce enormous amounts of studies that I sometimes feel are completely superfluous and without any message in the end. So focusing on what has really a meaning and a result, and therefore giving up in some regard with whole food testing. So my point in my question to you is, you said there are weaknesses in some studies. In the end you come to conclusions that look for me not really like reducing, but perhaps rather putting something in addition, feeding study with stacks events. Is that your idea that this is necessary, or was it simply a question?
It was, let me start with the last point, it was simply a question.
Can you use the microphone, please?
Yes, it was simply a question to bring it to the audience here, and I agree completely with you. On the one side, personally, I don't see any sense, any scientific sense, with this feed of the first generation. Yes, we have, maybe we test newly expressed protein, we test some other things in the rats or in the rodents, and we have now 150 or more feeding studies without any result. 6 years ago, I explained it to the commission in Brussels, and somebody asked me, why do you make such stupid studies? Yes, this was a very, very interesting question. Huh? But there's the other side, as I in the Specker. If we consider the public, especially in the German-speaking language in Europe, yes, Austria and Germany, they ask questions sometimes unbelievable, and therefore there's a certain time, maybe the next years, to show or to make such studies. Maybe also this very, very long-term dairy cow study in Munich, 2 years, very expensive, paid by the Irish government. It's very interesting. Therefore, I'm a little bit, from the scientific point, clear answer, we don't need such studies. But we need very important studies for the second generation. I mentioned the golden rice, for example, must be done something. But you're right, these are also this rat study, the whole feed, this is impossible to do it with the OECD protocol from 1996 with the whole feed, because this is done for single substances, yes, and now you have imbalances. If you will give higher portions of soybean, you have amino acid imbalances. Also, I agree with you, we made 380 questions from the public consultation to this topic, for example. Yeah, I agree with you.
Okay, we have two more from the industry here, but just now, remember, there are 2 minutes left before the next talk.
So can I answer your questions about golden rice? We don't plan any animal studies because golden rice is targeted for human benefit. We have the bioavailability result published in 2009, work done by Tufts University, Baylor College of Medicine. We have it in adult humans of different ages. There is a total of 5 studies, 1 published, 1 in press, 3 more to be submitted. We actually thought about doing work with Sherry with the Mongolian gerbil, but it would just actually help validate her model, use Mongolian gerbils to validate the human data, because we have the human data on bioavailability. And we won't do bioefficacy until if we get biosafety approval, then we'll do a bioefficacy study in humans.
I know this study from 2009, the others you mentioned are not yet published, but I'm not so really satisfied, because the blood, the serum, is a very bad indicator for vitamin A. Believe me, we have done many years studies about the best indications of vitamin E in the animal, in the human also, and these are only blood measurements. This is five volunteers. No?
Well, you're probably aware that there's a biomarker, actually 2 very large biomarker studies, one in the European Commission, and I can't remember what the other one is, but there was a review of them and in the OC meeting in Phoenix a couple of weeks ago. And getting a better human marker for vitamin A is also a target, as is zinc.
If you are satisfied, it's okay. But
well, I'm not going to argue with Tufts University School of Medicine or Baylor College of Medicine.
Okay, quick.
Good. Just 2 questions to think about, and not to answer now because there's no time, but I wonder the rationale and the purpose of doing a 28-day repeat dose protein study when you have something like Cry1 or whatever. I mean, to me that's kind of overkill, especially in another species that isn't necessarily relevant. The other one is, when do we quit with the animal feeding studies? I mean, we eat cows and pigs and drink milk from cows that are fed suboptimal levels of nutrients. So I'm not questioning the right of the EFSA or some other government to demand some of those studies, but at some level we have to say, when does regulation end and sort of the buyer beware, the animal producer, begin? You know, the farmer is going to buy the feed that helps grow the cows, pigs, sheep, and chickens at a level that gives a good production. And if it's not a safety study, then when do we think about having to do it?
This is completely right, but we have a little bit to overcome the consequences from 1996. There came some ship to Hamburg without any preparation of the European people. We started this year because of the problems with this soybean coming to Europe, and these are the consequences up to now. I'm not am I clear enough?
No, it's not safety.
Am I clear enough? It's not a question of safety, but if you ask in the European countries, they come back to this point. This is our problem still.